have talked to a lot of wonderful CISOs, CIOs, and some individuals who have not been in the healthcare sector have stated to me they have interviewed, so they have the skill set to work in any sector. And please correct me if I'm wrong, but the issue is that they're told no because they're not HIPAA compliant. Would Is it better to worry about being HIPAA compliant because the software, and in my head the software and the structure and things like that is pretty much the same. I feel like the HIPAA part is very small compared to having a secure infrastructure.
Are you talking about individuals
Individuals
being
who
hypocritical?
are, individuals being HIPAA compliant in order to get a job in the healthcare arena, they're being told no because of that.
Unless something changed, there's not a certification necessarily tied to that. I mean, you do have high trust certification, but that's for the medical treatment facility. There is a certification tied to high trust for an individual, but being HIPAA compliant, no, it's not really a thing. I mean, if you have the baseline certifications of the requirement of the job in the background and the training, can't guarantee you that you will get a job, but at least you can be in the conversation. And I'll leave it there.
Well, and let me maybe take a different approach. I've interviewed for jobs. So my background, I've been in government, I've been in law enforcement, been in healthcare, and I've been in now higher education. I put in for a job in the bank. They said, no, we don't want to hire you because you don't have banking experience or finance experience. I'm like, okay, but I've done all these other things, but you don't understand our rules and regulations. And so you wouldn't be successful as a CISO in this organization. I've even gone to an interview at hospital. So I worked at, one of the largest neonatal maternal fetal medicine companies in the United States, 600 locations, doctors in every NICU. But then I interviewed with a hospital. I didn't even get past the recruiter, honestly, because the recruiter went to the CIO for the organization. You don't have any experience in a hospital setting, a hospital facility where we have patients coming in and out every day. I'm like, okay, but I managed something like very similar or work in something that's 5 times the size of yours. I don't understand. And so I think, I think that's where you're going with the whole certification is having the experience and the knowledge in that area. It could be a detractor. To me, it shouldn't be, because you can go learn those things. You can learn how to, just like you can learn ITIL and you can learn GDPR and you can learn CCPA and all of these. I don't think that should necessarily disqualify you. It could be a deciding factor. Hey, I'm going to pick Eric over Don because Eric does have HIPAA experience, right? And he knows those elements within HIPAA. But brush up on them when you're going to interview and show that you understand it and you understand what the CISO's role is within HIPAA. And it shouldn't be a challenge. To me, it comes down to the individual you're going to work for. And if that individual is going to be that narrow-minded, that's going to be like, I don't even want to talk to you, I don't think you want to work there in the first